Mel. My name is Christine Miraga. So what I will be going to do now is to do the discharge of the patient. So the first thing we need to do is to check doctor's order for discharge, and of course to prepare the necessary forms to be sent to the to be sent to the business office. So next step is to obtain a business office clearance, allowing patient to check out. By the way, sir, do you already have a business office clearance? Alright, thank you so much. So next step would be to review and give patient instructions and answer questions to the following. So for the date of return checkup, sir, is that it will be on October 23, 2022 around 10 a.m. in the morning. So you will be going to have his checkup with Dr. Bisario. And then for the medication to continue, please remember that he must take in paracetamol 500 grams every 4 hours. Then his multivitamins every 8 a.m. once a day after meal. And then his ampicillin 500 grams every 6 hours also after meal. And for the diet instruction, he must eat nutritious food like vegetables and fruits. And for his breakfast, he must eat his breakfast around or every 6 a.m. in the morning. Then for his lunch, that would be every 11 a.m. And for his dinner, it must be every 6 p.m. in the evening. So for the any instructions imposed by the physician and the reasons for doing so, of course, the doctor said that he needs to avoid eating junk foods and drinking soft drinks so that there will be no less intake of essential nutrients and vitamins needed by the body, so that my patient, Mike, will have a healthy body now. And the next step now, since we have already provided those instructions to the patient, is that counter check for refundable items. So if you have their equipments or items that you did not use, then we can send it back to the pharmacy so that we can process a refund for the returned items. And the next step is that we need to give 2 copies of admission pack form to relatives or the patient for the refund. So, Sir Marlon, I will be going to provide you the 2 copies for the admission pack form. So here is your copy of the patient, and then this is for ours. And the next step is that we need to assist the patient in packing and double check drawers and then the closets or shelves for any of the patient's belongings. So let's go. We'll be going to pack your things now. Alright, come here. Okay, so you need to take off the hospital attire. So, alright. And the next step is that you need to escort the patient by wheelchair to hospital's main gate. So if the patient can walk, then there will be there is no need to use a wheelchair. So we'll be going to assist you into the main gate. So let's go. Sir, and my matmai here. Okay. And by the way, before I will forget, we also need to instruct patient or relatives to pass by the business office for refund of return of the items returned. So by the way, sir, please go to the business please go to the business office for refund items to be returned. So those are the items or the equipments that you did not use when he was submitted. So we will be going to process that for our refund. So come on. Alright, thank you so much. So now the next step we need to do is, since we have already instructed the patient and the relatives, then we will be going to do the aftercare of the equipments and the room. So come. So we will be going to fix the room or clean the room and also the equipment. And the next step is to remove patient's name from the directory. So we will be going to remove it. Alright, since we have already removed the name of the patient from the directory, and we will be going to clean the room and the equipment. So that is all the process for the discharge. So thank you so much, ma'am, for watching, and that would be all.